Hi, I'm Adrienne Easterling. I'm a physician assistant here at Premier Dermatology, and today I'm going to be doing a demonstration of a volume restoration treatment with filler. And this is our beautiful model, Stacy, today, who's one of our lovely estheticians here at Premier Dermatology. Before I get started, I'd like to kind of go over the anatomy of what's really going on underneath the skin, why we're seeing what's happening as we're aging. So why are we getting these tear troughs? And why are we starting to get a little bit of jowling in our lower face? So if you'll take a look at these photos, the first one here shows that our skull is actually shrinking as we age. And you can see that as when we're 35 versus when we're 80, our skull is resorbing and getting smaller. And one of the biggest places that's occurring is in our jaw and our lower face. Really, a lot of us focus so much on our upper face and restoring that lost volume in our cheeks, but really a lot of that volume loss is also occurring in our lower face. You can even see how our mandible, so that jawbone, is going up and inwards, and then our cheekbone is actually kind of becoming more lower and more recessed. So by using filler, we can revolumize the face naturally and make it look just like we were in our 30s. And I actually have a photo of lovely Stacy in her 30s to show you, so you can kind of see the difference, where we're not trying to change the way Stacy looks by restoring volume in her face. We're actually just wanting to bring back what she looked like 20 years ago. It's actually crazy to think that she's 54 years old and looks incredible. But
somewhere in the middle here.
Yes, definitely in the middle here. But what we're gonna do today is help give that youthful appearance back to her jawline. So we wanna keep it feminine, of course, so we're going to round back out her chin and give that projection back. So we want to give projection to the chin here, and then we'll want to keep the jawline slim and contoured. Here's another photo to show you the difference between a female and a male jawline. So in this photo, you can see how the male jawline is more square or boxy. And even if you look at the chin, it's more straight and not as rounded. And then when you look at the female jawline, it has a different angle. There's more of an angle this way versus up and down. So our goal today is to keep it feminine and also keep it and just really lift. The goal is to help with this jowling and give her that etched-defined projected chin that she had in her 30s. Okay, so let's take a close look now at Stacy before we get started. I always, before I get going, I really take a look, and I like to look at every angle and even have her tilt down for me. And so as we all know, gravity changes the way things look. So when her face is more downwards, she does have more jowling, versus when her face is more up, it's more taut. So go ahead and look down again. So again, by restoring that volume loss, we're going to hopefully help keep her lifted as she's looking down. Again, restore this projection in her chin, and then even help with this little marionette line that's beginning to form here by restoring this volume loss along the bone here. So I'm continuing to now elongate the jawline downwards. As you saw in that photo, our jawline is shrinking upwards. So we're gonna put it back where it used to be. Another nice thing about treating the jawline is that it actually helps lift the neck. So I have some people that have submental fullness under here, and it will help lift that. Stacy is perfect, so she doesn't have any of that. And the filler does go along the bone because that's where it's natural. And you won't see it when she's animating or talking. And it's actually not very painful. We did numb her topically with topical numbing cream before we started. And I transfer the filler into these tiny little insulin syringes to make it more comfortable, and also gives me more control of where the filler is going as we're injecting. And I'm gonna be just treating one side today so you can see side by side, and then when I'm off camera, I'll be finishing the other side. And we also don't want a witch chin where it looks pointy. So you'll see here that I'm going to tailor out the filler also to the sides to blend it as I go, which will give it a very natural appearance. Doesn't look like she has a pointy chin. So here, when the chin's down, I can see more of the shadow that's occurring in this area here, which we call the pre-jowl sulcus or the marionette. So by restoring that volume, we can help hide this shadow. It just lifts that up without actually having to put filler in the skin, which can sometimes look a little bit funky when we smile. Beautiful projection, which also aligns nicely with the lips and nose. And as you see, I'm just injecting small amounts at a time, which makes it look more natural. There's not big balls of filler under there. So you can already see on this side, when I pinch, we've restored volume, versus this side. When I pinch, you can see that loose skin there. This side is now more lifted, which also helps to turn up the side of her lip as well. Whereas this side, you're still seeing the shadowing here. Still want to give her a little bit more lift to this jawline. So what I'm going to do is use a cannula and thread a little filler here more superficially. So now we have the cannula inserted. Now we're going to add some projection behind here. So you can see where the cannula is here, and again, it has a blunt tip. And this way I can go a little bit more superficially. And a lot of the time, the space in front of our ear can start to hollow and cause us to look more, our jowling to look worse. Okay, so we've treated one side of her face. And as you can see now, her jawline is lifted and contoured. The shadowing in her marionette is now gone. And if she turns her face downwards, you can see now when she looks down, her fullness here is more lifted versus on this side. You can go ahead and turn to your right. And you can see that beautiful etched jawline here with projection that goes down into the neck. So it actually helps lift her up fully here. And then versus the other side, where she still has some jowling on this side. So again, she's restored volume here. We've gained projection back in her chin and then contoured and defined her jawline.